your name is a staple within our foundation. So I think you need very little introduction. But just for those on the call, Dr. Albert is a very special, very special human being. He has an extensive, like, I mean, if you go over his CV, it's just it is very long. But as it relates to this talk today, just a couple of things I wanted to share with the group. One is, he's trained over 100 fellows. He's trained, I don't know how many hundreds of residents. And as part of that, you develop a reputation for better or worse, and his is by far for the better. And he has influenced so many young minds and young surgeons within our field, including my life. That has he has a very special gift, and probably one of my favorite things is, like, whenever you hang out with Todd and have the opportunity to be with him, you feel like the most important person in the room. I think that's when you know you're with someone really special. And I think of Dr. Akbarnia having a very similar quality, and definitely a similar stature for me in my life as Dr. Albert. He's also taken an organization like the Rothman Institute from a very good institute when he started there in his role as a leader and president. And by the time he left, this place exploded, and it was amazing to watch and to see how he was able to translate his leadership qualities and influence hundreds of surgeons, even in his community, to follow a common goal and vision. And then he took that to HSS as surgeon in chief, and that's where he gets to be now. But I think the best thing you can ever do to examine a leader is not only what they're able to do in their professional lives, but what they're able to do in their personal life. And Todd has been a tremendous leader in his family. He has a beautiful wife and four amazing kids. And to see the success that follows him and his family, I think is really just an example of what we all really aspire to in leadership. And so, with that, I'm really excited to have you talk to us this morning about leadership in spine surgery, and as we take this into our own practices. So thanks for being here this morning, and we're blessed to have you.
Well, Greg, thank you so much. And that is the nicest introduction. I would just say, are there any questions? That's good. You don't need to hear from me. Um, just kidding. Just kidding. So it is great to be able to share some time with you all this morning. And obviously, Greg asked me to talk about leadership in spine surgery. What are my obligations going into private practice? And I would frame it slightly differently, because I don't think it matters if you're going into private practice or in an academic institution, because academics is a state of mind, and wherever you're practicing, I think you're going to be an academician. You're well trained. You're at a great place with great mentors, and you have to always constantly examine what you do. What did you do right? What did you do wrong? And that practice of doing that, I always say, it's why they call it being in practice, because we're constantly trying to improve. And you're going to have to be a leader inside your organization, no matter how small, whether it be with residents, with fellows, with your team in the OR. So I think these principles are incredibly important. And so I tried to put it together with that in mind, using at least my evolution in practice as somewhat of an example to try and give you some insight. So I really also wanted to focus on building teams, because I think that's incredibly important wherever you go or whatever you're doing. And these are my disclosures. All the industry stuff may or may not be important. I don't think it's as important as the experience and learnings I've had being able to be, a chairman, a surgeon in chief here, and the president of a few societies. I've learned more and than I really almost learned being in practice. And if you think about, this is just the definition of what a physician is. And we are skilled in our art. And if you think we aren't and don't have challenges in what we do and humbling experiences, we certainly do. But this guy, James Mathis, Larry Mathis, who was the CEO of the Texas Methodist Hospital, really had a more dim view of physicians training. He said they're consummate professionals, the best and the best, the best and the brightest of the best and the brightest. But when we leave our world of medicine, and enter into business, where business principles were a danger to ourselves and others. I don't think it's really true, and I'm going to tell you why. And I think the first question is for y'all, what does it mean to have a spine practice today? What is it? I think it's challenging. It's certainly humbling, as we all know who practice it. It is exciting and it can be incredibly rewarding. But if I use the example of my stages of my career, and I break it into about 4 stages, um, and my training was 87 to 93, and I was lucky enough right at the cusp after I finished my fellowship to do a North American traveling fellowship, which I thought was incredibly helpful, both for connections of leaders in America, but and getting an early start on getting those connections, but also in seeing other practices and other institutions, how they did things. And then my phase one, all I was trying to do was be busy, but also to do some academics. And I just put the breakdown, rough breakdown of cases. I did a lot of cervical spine because I was the cervical spine guy in our practice in Philadelphia. I did a bunch of scoliosis and lumbar degenerative. That was the breakdown. But then as it became where I became more involved with leadership, both being a vice chairman of our department at a fairly young age and then a chairman, I changed. I was still super busy at the Rothman Institute, but my quality of my practice changed between my phase 3 and phase 4. Toward the end of being a chairman, I started really dialing down doing complex deformity and shared it much more with other people and focused more on cervical spine. And when I came to HSS, I still did a fair amount of surgery because I believed that a surgeon leader should be a surgeon. It may have been one of my leadership mistakes. I may have done too much surgery while I was trying to also do this very heavy administrative job at a very busy hospital. But you can see how that changed. And then post being surgeon in chief, I was like looking for what I could do. And so I did private equity. I still do private equity and started a fund and do leadership coaching, which I love, and both internal and external to HSS. But what have I learned along the way? I've learned that spine surgery is really challenging, and I think you all know that from being in training and or early practice or in practice. You definitely need a great team. You have to have colleagues that you can trust and work with. You have to celebrate your successes as a team, and you have to really analyze your failures, so to speak, or your challenges. It's a contact sport for sure. You have to have great relationships with your physiatrist, I think, and your radiologist for sure, and your anesthesiologist. Be honest with your patients and your family. You never give up, no matter what the challenges are. And if you have a choice or can kind of focus your practice, radiculopathy, myelopathy surgery are really successful. Deformity surgery can be really rewarding, but really, really challenging. And tumor and trauma are tumor and trauma and are necessary for us to take care of and also exciting. But I think um, all of this provides leadership training and involves leadership in everything we do. Now, if you have the ability and you're starting in practice, I think complete immersion is really helpful. I immersed myself relatively early in my career on 2 aspects, both deformity and cervical spine. Lumbar degenerative was something we did, but I really immersed myself, and we did research in it. But if you immerse yourself, it can help your clinical practice, your academics, your research, both and innovation, and I think your leadership as well. But everybody, and I know you get this training every day, remember that the outcomes that we produce really start in the clinic. And Ian McNabb, who's a famous guy from Canada, said, it's not the incision, it's the decision. So the successes start in the decisions on who you operate and what you do, because even the experts in our field can't agree on all these things. And with every new innovation, the complexity and the debate keeps getting larger. So I would say we should look at what we do as like any innovation. We should get, if you have an idea, an innovative idea, you might prove the possibility of a new technique. You discover the potential of for its benefit or harm. You explore, you refine, and you standardize that new technique over time. And you compare it to what your current practices or the current best practices are. And ultimately, and what we should be doing now, we review the quality control and the long-term outcomes of everything we're doing and compare it to a historical past. So where do we all need to go? We need better assessment and we need long-term study. And this is something you can do whether you're in private practice or in academics. There are so many systems now to collect data. If you develop a busy clinical practice, I think it behooves every one of us to be sharing that, studying it, and sharing it. And so what does it mean to have the spine practice today? We should be trying to solve our unanswered either personal problems or the problems all we share with our colleagues. We should realize we need to have a good team all around us and keep the highs low and the lows high as you go forward. But I think all of it requires leadership. And this is my favorite definition of leadership. It's an old one from the AOA: the art and science of developing, promoting, and implementing a practical vision and goals through unselfish, responsible motivation and skill for effective group action, unselfish and group action. And why is it important for every person on this call to care about leadership? Because we have this incredibly rapidly changing landscape in medicine. And it's that old thing. If you're not at the table, you'll probably be dinner. So we all have to participate, whether it's at our micro level inside our institution or at a bigger level to try and keep things best for our patients and ourselves. And I thought it might be instructive to talk a little bit about my history. I would say I was an accidental leader. Greg gave that beautiful and very complimentary introduction. But I didn't go to med school saying, oh, I want to be a chairman. I want to be the head of this. I never, ever, I thought I was going to be a family doctor. And I ultimately went through med school. My med school roommate was a guy named Mark Everett. We played football together. He said, oh, you should come up and visit my dad. He's a doctor. You want to be a doctor. And he was the chairman at the University of Rochester, ultimately became the dean at Penn State Hershey, really still a mentor of mine today. He's 90 something years old. And he's an amazing guy. But I saw what he did. He was a joint surgeon, and I'm like, oh, I want to do that. And it was funny that I ended up becoming a little what he was, a chairman of a department, and on and on. But I became a chairman, a leader accidentally when I joined this a great group in Philadelphia, the Rothman Institute, and my mentor, Dick Rothman. And 3 years after I got there, the three senior guys kind of had a fight over the first private equity endeavor, and they want some couple of the senior guys wanted their name on the door, whatever it was. They left, and Dick turned to me so about 4 years into practice and said, "Would you like to be the vice chairman?" I didn't know. I was like, "Okay, I'll do whatever you need," and it gave me the opportunity to very quickly learn what it was that you could influence the group and to be helpful. So I was able to do that, become the chair there, and then the SIC here. And over that time, I was lucky enough to be the president of CSRS and ultimately SRS, and then do the things I mentioned for the last 4 years. And it was all very, very useful to me. But what I realized was that nobody's an island. Everybody has to participate in leadership, and you need to be able to grow the team so that everybody's pulling in the right direction. And so no matter where you are, whether it's the OR, whether it's just in a small practice or you're doing research or even in the for the residents, or at a bigger level, hospital, society, medical school, deans, et cetera, or the largest level, government, all of it requires leadership. And what are the challenges? And I would just say, as you look at this picture, which I love, all of us should aspire to being the leader at the bottom of the picture as opposed to the guy at the top of the picture. And you have to learn to manage a group of highly talented, motivated people. You have to understand finance a little bit, no matter what. You have to optimize people's performance. You have to balance the goals of the doctors with the goals of the hospital, because they're both your partner, no matter where you are. You have to maintain and build a culture. And you have to, if you're going to be a leader, you have to balance your clinical practice with the administrative responsibilities, which you will have. Because even if every single person is going into a private practice, there's a bunch of administration that goes along with a private practice. And so everybody should think about what your leadership style would be. Um, and what happens is that we need to go from an approach where we think about ourselves to thinking about what's great for the whole group. And when we're training throughout the medical process, up to even through fellowship, it's more of a passive thing. People tell us things, we absorb it, and then we do. But what has to happen as we mature is we have to be accountable, but also engage where we become part of a larger team. And I think it's really important. There are these kind of two mountains. We focus earlier in our career on our individual goals, trying to get to our residency, trying to get into med school, trying to get into residency, then the fellowship, and what's the right practice. And there's a inherent focus on acquisition across every one of these defined milestones because we are in a competitive industry like many. But I would ask you to think about the second phase and the second mountain, whether you're even if you're just going into practice and you start to become a leader, like I said, a leader of a smaller group or a leader of a larger group. And the smaller group could be your operative staff or whatever it is, or your research group. And in the second mountain is when you start to think about others and place others in front of yourself. And I would, and the analogy is from going from a track team to a football team. The football team, everybody works together generally for a solitary goal. The track team, people work as individuals to attain an overall goal. And I would look at it that way. And what's really important for those of you starting in practice and those more established is creating the correct team. And this is a book I would really recommend to you, The Captain Class, where he studied multiple teams, volleyball teams, badminton teams, all kinds of teams throughout history, and said, what was the most important thing? Sam Walker wrote this book. What's the most important thing about that got all these teams as winning? And it was the captains. And he looked at what were the qualities of those captains. And the most important thing, and Richard Hackman noted this, that 30% at least of the variability and efficacy of a team is the way you launch the team, is how you create and put together the team. So here's an example from Sam Walker on what the map should be. And it's very small on my screen, but on your screen, I'm hoping it's bigger, where you can see that there's all these different personality types. And if you're going to think about what the quality of the entire team is, and Dick Rothman used to say, it was a quote from Walter Annenberg, it takes many crooked timbers to make a strong house. You need many types of personalities on a team to make the team really effective. And everybody should have a role, either a major role or a minor role. And here's just an example of something that was done. I've covered the faces, but from the leadership team of HSS, where they went through interviews and what role would they play. And something Brian Kelly did as he was becoming creating his team as both surgeon in chief, and now he's going to be the CEO. But interviewing all the guys, the critical guys, and what role will they play along the team. So it's something I would ask you to think about as those of you starting your practice. The first, and I think most important member of your team is your healthcare extender, whether it's a PA, a nurse practitioner. Really important to pick that person very well. The other thing is the environment that enables the team to be really successful. The base of that pyramid is trust. Then you conflict. What conflict means is not that you have to have conflict, but you have to be able to have enough trust that people can speak up and disagree in a positive way when they're working together in the team. And obviously, commitment, accountability, and ultimately, the goal is to attain the best results. But also, how the team works together. There has to be the psychological safety within the team to be vulnerable. You have to have dependability, structure, and clarity of what the goals are, heading toward meaning and the ultimate impact of what you do. And it's another book I would recommend, Legacy by James Kerr, where he embedded himself with the New Zealand All Blacks, the most successful sports team in the history of sports, really, they as a rugby team, and just defined what made them such a good team. It was character, adaptation, purpose, that even the heads of the teams, which they called sweeping the sheds. Anybody, no one was too good for any role. And there was a culture associated of constant learning, very important. So I'd recommend that book. And obviously, maybe probably the most important thing is who's the leader or how the leader acts. And this is another very important leadership book, I think, by Jim Collins, Good to Great, where he looked at like 11 companies and compared them to another 11 companies, the 11 companies being very successful versus those that weren't. And what he found was that each really successful company had a level 5 leader. And while everybody on this call, I would guarantee, is at least a level 3, a competent manager, the level 5 leader is a different type of leader. They combine a professional will with a personal humility, where they demand superb results, they have unwavering resolve, but they're humble, they're modest, they give the adulation to others when necessary, and when things aren't going so well, they take responsibility. They don't blame somebody else. This is compared to level 4 leadership, and this is Lee Iacocca, who ran Chrysler, which ultimately went bankrupt post his leadership. And 2/3 of those comparator companies in Collins' book had a CEO with gargantuan personal egos. They set themselves up for success, but not the company. And often the company would fail afterwards. And so this is just another book that teaches what a leader should be. And I think it's really good. It's one of the best leadership books. It's multipliers. And the idea of a multiplier, the multiplier effect is that's a leader who makes others around them smarter. He gives people tasks to do. He or she creates debate, as opposed to the diminisher is that level 4 type with gargantuan ego that doesn't allow for debate and doesn't allow people to grow. So I would look into that, and this is just the comparator of multipliers to diminishers. And so people ask, could I become a level 5 leader? And no one knows, but my best advice is to study those who are, study history, look at great leaders, and I think you can ultimately attain that if you really, really want to. But a lot of it involves selflessness, vulnerability, and humility. There are other things that great leaders do. They have an open communication from the bottom to the top. They don't stick their head in the sand, and they allow really open communication throughout. I would also say the other thing that great leaders do is to get the right people, hire the right people, and put them in the right seat on the bus. And one of the things you must do if you hire somebody or are working with somebody that could be good, but they're not in the right seat in the bus, and this is very difficult, you have to be willing to move them to a different seat on the bus. So I think the transition from physician to physician leader is seeking feedback through mentorship. And you all have great mentors where you're training there in San Diego. Remain agile, prioritize the group contribution and professional fulfillment over singular individual accomplishments, going to that second mountain from the first mountain. Develop leadership management and business skills. I think it's helpful throughout in your family and in your leadership position. And I always recommend to practice Stoicism. I never leave this talk without a plug for Stoicism. It's really been helpful to me. Of all the things, of all my accomplishments I've been lucky enough to have and my challenges, Stoicism has helped me the most when things have been challenging. And the basic idea of it is Marcus Aurelius is like the father of Stoicism. He wrote a book called Meditation, which was a diary that he meant for himself, but it's like the Bible of Stoicism. And the idea is you can't control any external thing. The only thing you can control is your response to it. So I would start with The Obstacle is the Way by Ryan Holiday. He also has a little web thing called the Daily Stoic, where you get a little meditation every day. It's simple reading, and it'll teach you about Stoicism. And as we finish up here, I know the Dalai Lama recently has had a little troubles when he like tried to suck the kid's tongue, but I think it was probably innocent and a mistake. But I still like this. He talks about the three types of leaders: the ferryman, the shepherd, and the trailblazer. But every one of them is different, but what they have in common is caring more about those that they are leading than about themselves. And I think this is the critical thing in leadership is you have to be ready to care about those that you lead more than yourself. And if you do so, whether it's in a practice, whether it's in a hospital, whatever it is, if you care, you will care about how the group does, you will have a successful outcome. And these are kind of 10 traits of a physician leader as we finish here. You have to promote a clear vision. You have to admit and learn from your mistakes and be humble. You have to treat people with respect, empower others, and delegate. Really, delegate is it builds, is being that multiplier, is building everybody else up. Criticize people only in private. Stay close to the action. A surgeon leader, I think, has to be a surgeon. Study and practice Stoicism, study level fives and try to be one, build a great team, and inspire the team to act like a team. And we also always say, my wife always says to me when I get mad at the kids, well, did you ask the question first, rather than going in there with both guns blazing? Don't just give the answer. Engage in dialogue and debate, not coercion. Conduct autopsies without blame and build red flag mechanisms to allow for alarm to be raised without criticism. But the most important thing I wanted to kind of end with was leading with questions and not answers. And I'm going to show you an example of somebody who didn't exactly do that. So lead with questions, not the answer. And I wish for all of you success, fulfillment, time for your families, and leadership for any environment you're in. I think it's super important. This is my family that Greg alluded to a little earlier, and to prevent burnout, spend a bunch of time with your family. That's the best thing you can do, and nurture them, and they will nurture you back. So thank you very much. I look forward to any discussion or questions.
Awesome,
awesome.
Todd. Thank you.
Thanks, Rob.
Hey,
Super.
Todd, I'm reading this book called Leadership Pain. And what's your take on the value of pain in growing as a leader?
Well, it is, I would look at it like I think it was Epictetus, the Stoic said, when somebody insults you, wrongs you, creates pain for you, look at it just like when you're training. Greg, you like to bike. When you're biking the 120th to 30th mile and it's painful and you hate it, it makes you better at biking. And when you're a boxer and you're sparring with somebody and they punch you in the face and you're like, get mad for a minute, they're making you better. They're training you. And if you can take that attitude that it is helpful, which in the moment it doesn't feel helpful. I can promise you that, and it's painful, but it's like every experience that is a challenging, troublesome experience in your life. In the end, it makes you stronger and better.
That's awesome. One thing that they also said was like, if you're not feeling much pain, you're probably not leaving much, because
Yeah.
I think I've encountered that a few times in my life too.
Yeah.
But
Yeah.
raising the threshold on pain is in some ways, I heard that like resonate throughout your talk a few different times.
Yeah.
Even like the obstacle is the way, right? That's the whole idea of like digging into the problem instead of, avoiding it or becoming numb to it. So
Yeah.
yeah.
Yes.
Hey, Todd, Jamie Breffy here. I have a quick question for you. I see on your slide, your last slide here, you've changed, I don't know if you've changed your title, but is this your corporation now or what?
Yeah, so I have it's a leadership. I do leadership consulting for people that are like I have a few people that have become chairs of different at hospitals and stuff where I help them out. So it's like I created a little, somebody's asked me after I give one of these talks, oh, do you do that as a business? And I'm like, sure I do. I didn't. And so I created this thing and started doing it.
Right. No, it's funny.
So
I look at this as a natural evolution of what you've done your whole career. Yeah. Have you read Arthur Brooks' From Strength to Strength, the book?
yes. Oh, it's amazing.
It's
Yes,
amazing.
I have.
So the idea of the fluid intelligence going to the crystal intelligence, which
Yes.
is where I kind of feel like, I am too in this. But this is what I see, this mentorship that you're taking on is the right path.
Yeah, thanks. Yeah, it's
Yeah.
been fun because when I do it and people come, I have a weekly call with my different people I'm doing it with, and they say, this is what happened this week and this one, and it's interesting, not to sound egotistical, but there's almost not one problem I've been presented with that they have that I'm like, I've seen this movie before a bunch of times, and this is like, so yeah, it's very fun. Thank you for asking.
Sure.
Yeah.
Sure.
So for those who are interested, Bert Yaze is doing that with Todd, and he's absolutely loving it. It's been a huge help to him.
Yeah.
So just to put a
He's
plug
great.
for Todd. Yeah.
Thanks.
Well, Todd, listen, we're past the hour, and so blessed to have you. Let you get back to work and do your medical part of your job. And thanks for everything.
Thanks, guys. Thank you.
Thank you
for
so
having
much.
us.
Thank you.
Thank you.
Dr.
Great to
Albert.
see you.
Thanks, Dr. Albert.
Bye-bye.
See you guys.